Michelle, it's interesting. We've spoken to some people on the ground, including operators of hospitals, saying that they do expect to either be over the peak by the time we get to Lunar New Year, or potentially we're already getting to that point now. I know there's limited data available. What do we know?
In the big cities of China, Beijing, Shanghai, others like that, the peak at this point is believed to have been passed. We know that there were huge numbers of infections. We saw those waves of deaths, reports out of crematoriums and healthcare facilities that were really struggling with that early in the outbreak. And the waves generally do last for 6 to 8 weeks. So the peak being half of that, we are already through it. Of course, the fear is that the virus is moving out to the rural areas and that it'll be some time now, still a few more weeks before the country entirely gets over COVID. But it is looking like they're on the downhill slide at this point.
Michelle, we recently heard the WHO's warnings about the predominant strains of Omicron variants across China. Should we be worried at this point about potential mutations, given just how big the population in China is and how rampant these infections are?
Well, it's an interesting question because now at this point, everyone in the world is worried about mutations. Now that Omicron has really gotten itself well-seated in China, people no longer have to worry about that. Everyone is worried about the next mutation. In China, it's an interesting scientific question because there has been so little natural immunity in China that the virus didn't really need to mutate very much in China in order to infect people. And we've seen that in terms of the speed with which this virus has hit everyone. And in fact, in other places where there is more natural immunity, the virus has had to work harder, and we have seen different subvariants of Omicron spreading. The point is now, though, that everybody's on a level playing field and everyone's going to have to worry about the next thing, and it could really come from anywhere. We think that it would happen in somebody who's immune compromised, where they're getting aggressive medical care so that they're able to survive, but the virus continues to mutate, and that could really happen at any point. Is it possible in China? Absolutely, but not necessarily more so than the size of its population.
In terms of the preparedness of the country from a health system perspective, with this reopening, it has seemed quite haphazard. If we're now potentially over the peak, what does that mean when it comes to the need for antivirals, the need for an mRNA vaccine, for example? We're hearing that the talks between Pfizer and the government have come to a stalemate at this point.
Right. Well, at this point, there are still, an overwhelming number of infections. Millions and millions of people are infected every day. And in fact, millions are likely dying every day. And so it's important to get Paxlovid and other antivirals to those people as soon as possible. But your question is a great one, because by the time they get through all these negotiations and start getting more of this medicine on the ground, to what extent is it still going to be necessary? It kind of goes back to the earlier question about variants, right? We know at this point that COVID is not going to go away. This is something that we will be dealing with, into perpetuity now. And as infections come back and as repeat infections come and new variants come, there will be the need for vaccinations and antivirals, perhaps not as much as there is right now. But yes, Pfizer and China, the talks have broken down in terms of getting lower cost products on the market in China. And at this point, they do need it, but that is going to continue into the future. So hopefully they make some progress here in the next couple of weeks.